More states are declaring states of emergencies in response to the monkeypox outbreak. California, one of the latest. And now the White House says it's announcing new leadership to handle the rise in infections. But is it too little, too late? Let's break it down with global health expert Dr. Yalda Safai, who's live with us here on Fox 5 tonight. Let's get right to it. How much of a threat is monkeypox right now, doctor?
Okay, so I think we're all a little bit burnt about what happened 2.5 years ago, so everybody's on alert. But you got to understand that monkeypox is not COVID. We're dealing with a completely different type of virus. Monkeypox is not as easily transmissible as COVID. Yes, we're seeing about 6,000 cases in the U.S. right now, with most of them populated in New York, California, and Illinois, which makes sense because they're more populated, dense cities. But on a national level, we still haven't declared a national emergency. And on a national level, it's not cause for concern at this point.
As we look at the news coming out, and we know there are a lot of people that believe that there is only a certain subset of Americans, namely gay men who are largely susceptible to this. While it is true that there's a large number of gay men who have contracted monkeypox by intimate contact, by close contact, it is not something that is exclusively confined to that community.
Of course not. Monkeypox is spread through skin-to-skin contact, bodily fluids, respiratory secretions, as long as you're close to the person, and fomites, which is contaminated towels, contaminated beddings from somebody who had monkeypox. This is not a sexually transmitted infection. However, because it spreads by bodily fluids, it can easily be transmitted through sex. I think that's what people are not realizing right now, but it's really important to emphasize this is not a sexually transmitted disease, and it's not only in the gay community.
We know that there have been efforts to vaccinate people against monkeypox across the country, including here in D.C. And because there seems to be a shortage, or at least not enough of this vaccine to go around, they've decided, at least here when it comes to Jynneos, to restrict people to the first dose for the time being, rather than do a second dose right now. What's your take on how people have prepared for this? Does it come down to being too little, too late, or is this something that will get under control soon enough?
And because it's not easily transmitted like COVID, it should be able to get under control soon enough. But we have to act fast. There's already 6,000 cases, and the first case was in the U.S. in about May. So are we too late at this point? Maybe. And we still haven't declared it a national emergency. But like I said, it's not as transmissible as COVID, but we need to take precautions at this point to avoid another public health crisis.
No doubt about that. Dr. Yalda Safai, always appreciate the insight. Thanks for joining us.
Thank you.